Hi, I just want to do this Athena template here showing you how to do a toenail injury. This is a little 13-year-old boy that came in for right toenail trauma. Just to show how this works, the medical assistants here filled this out. He injured his toe in December, and the review system was already there. They did take a picture, so you can see the picture here. So the right hallux, it's blood underneath it was attached. And so we didn't need to do anything to this. Circulatory was all fine. For the toenail, since they have an ingrown toenail exam, you could choose something else, but there was no erythema, no probing, no granuloma. There was really no drainage. And it was the right hallux. The nail was detached to base of nail, but distally attached. Dried blood was under the nail. Okay. And I didn't do anything even for this. So a couple of, you could do subungual hematoma. And sometimes it pulls in the wrong code. So this would be an other nail disorder. You can also do toe contusion with damage to the nail. And so you fill this out. When you click this little box, it can extend, and it's easier to look at these than it is right over here. So it's great toe, initial, and it's on the right. And it says with damage to the nail. So I can do a couple of those. And then these dot codes, you do contusion of toe. So all these you'll find on the bottom of this video. I'll send you these are called dot codes. So basically it's the stuff that I put in here to make the discussion notes go quicker. His pain was for toe, I would say toe injury, and so you sort of tweak him a little bit. I didn't get an x-ray, okay. And basically the symptoms should resolve over the next few months. A new nail should grow out under the older nail. Okay. And so if I want to save this, it's pretty easy. So I had the contusion of the toe. So if I want to save something new, I just click this and it makes a new macro. And I can give it like contusion, or I can do like subungual, and then hematoma. And then it says here no spaces. So you have to put like an underline, make it available in the current section. If you want to edit the text, it'll show you that text right there because sometimes it might be different. And then you save it, and then it saves it. So the next time I'm doing something, if I want to do a subungual hematoma, it's right there. Okay. There's just kind of another one I have previously. Okay. And then, so he doesn't need to see me back, so there's not going to be any return visit. I sign the orders. The letter is going to go to his primary care. And it's a new patient visit. Contusion, didn't do anything else. You can save that. And then that's about it for how to do that. So if this was helpful, there are some links underneath this video to learn more. If you want all my templates, or if you choose Athena, just give him my name, Don Pelto, and I'll have to send him an email, and you can have all my templates and all my discussions and all that stuff. Just makes it a little bit easier when you're starting out if you do choose to use Athena. Okay, thanks.